Hello. I'm going to talk about an interesting area of an interesting part of the body which often is not very visible or exposed but does bother many people. I'm talking about knee area, I'm talking about calves and ankle. Now knee, calf and ankle has a certain proportion as compared to the rest of the thigh. It has a certain aesthetics and I'll show you the aesthetics. Let's have a look at the knee. Now knee has this bone and it has those grooves around that gives a bit of sulcus, okay, and that gives a bit of definition. And if you see the next one, it does have contour as well, and these are visible in lying down position. You will see a mound and you will see a very smooth transition from the knee to the thigh. And if you see from the frontal position, again also it has aesthetic curves both on the inner side and on the outer side. Now let's look at this young lady. She's fine. She doesn't have a lot of fat. She exercises, but she wants more definition in the knee. And why not? If you can. So if you understand the aesthetics, you can actually target that area, and you can do a very minimal procedure like a laser lipolysis or a laser liposuction, and you can take out the fat from all of these, and you will see the outcome. You will see the definition of the knee improving, and in the next one you will see it improving in the front area as well. So there she is. She has got that stubborn fat taken off from the knee and then gives a bit more enhancement. Now if you move further, we will see this is another example, slightly more chubbier than the previous example, bit more fat, mostly on the inner side. You'll see that bulge there, and it's very easy to address that. It's a very simple procedure. Local anesthesia, take out the fat and you get this contour. Then as we move on, we go to another patient, slightly more, okay, bit more, and a bit of excess skin as well. These are a bit challenging. Now just removing the fat sometimes does not help us. We need to advise the patient to do a lot of toning exercise to have a good skin shrinkage in that area, and that gives a good result too. Now let's have a look at the lateral profile of the same patient. You will see that bulge which is above the knee, that's reduced. So there's a smooth transition from the thigh to the knee and from the knee to the leg. Moving on, let's look at the calf and the ankle. Now there's a certain proportion between the calf and ankle, and it's like a funnel, and often that proportion is lost. Now if you see from the front, there's a bony prominence that's visible that gives its definition. There's a curve on inner side and outer side, and if you see at the back of the calf, there is a tendon which actually also gives a certain shape to the back of the leg. Now this one you will see, she has the problem where the fat is covering her bony prominence, and you will see the fat covering the shin area of the bone, yeah, and the fat covering the side and on the inner side as well. So that gives a bit of bulge effect, and it gives an appearance called as cankle. Cankle means where the ankle also tends to look like calf. So what we can do with this, we can actually do procedure to remove that fat under local anesthesia. Simple procedure, take away the fat from the thigh, from the inner side, from the calves, from the inner side, from the outer side, from the back of the thigh, and you can see the result of that patient. There she is. So it looks a bit more, proportionate, sleeker, and I'm sure she'll be very happy to wear the dress she wants to wear. Now let's look at the look from the back, from the posterior part of the thighs. You can see again that uniform fat collection which was there all over the leg has been removed, and now she has a contour in the calf and she has a contour in the ankle. Similarly from the sides, you can see the difference that takes away that bulge and gives a bit more thinner leg.